Good afternoon, everyone, and welcome to Webinar Wednesday. I'm Tammy Serrano, Project Support Specialist for Florida IPDE. Facilitating our webinar today is Dr. Rochelle Kenyon. Dr. Kenyon is a nationally known trainer, consultant, and educator who specializes in adult education, literacy, and disability issues. You may recognize her as a subject matter expert for the Disabilities in Adult Education group within the LINCS community of practice. Today's agenda is packed with information and resources surrounding the LD learner. You will learn how it affects your learner and some new activities that you can use. Today's presentation is being recorded. It will be archived and available on the IPDE website within 48 hours. As with our other webinars, your microphone is currently muted and you are in listen-only mode. However, we want to ensure that your comments are heard and that your questions are answered. Please use the Q&A option to type in your questions and share any comments and ideas that you may have. Lastly, don't forget to join us next week for part 2 of this webinar. Okay, Rochelle, let's get started with the webinar titled LD Primer for Adult Educators.
Okay, we're on slide 2, and so you can see if you have questions, you type it into the Q&A options. All right, I'm so happy to be here today. Thank you for the introduction, Tammy. And I'm so glad to have so many people who signed up and who are interested in the topic of learning disabilities. I want you to know that any questions that you have, I want to answer. On the last slide of the presentation, which you will have copies of, you'll have my email address. And if we don't get to your questions today, please make sure to email me at my address. And my email address are kenyon721@aol.com. And I will get answers to your question right away. Okay, let's begin. We have a packed agenda for today. You can see that the topics that we'll talk about include information processing, what is a learning disability, statistics, something called the LD discrepancy model. We're going to look at characteristics of adult students with LD, look at their deficit areas. We're going to concentrate on 3 of the most common types of learning disability and their causes. Then near the end, we're going to look at screening for learning disability and what you can do in your own classroom. I'm going to have a homework assignment for you, some resources, and then we'll wrap up. On slide 4, the outcomes. This is what I expect will be the outcome after attending this session. You can see at the end, the last bullet says, I expect that you'll be able to administer a free LD screening tool to an at-risk or one of your classroom students. And we'll talk more about that. And you'll also have the actual tool. Okay, let's begin. You'll know whether or not you have had students in your classroom in adult education that might have a learning disability. So I'm going to give you some background information to help you. We're going to talk about information processing. Information processing is one of the major deficit areas with learning disability. So if you look at this model here, you'll see, you read it from left to right. So the first thing would be input, either by sight, hearing, touch, taste, or smell. That's the input. In between input and where the brain would be is the attention. Then decoding and perception takes place by the brain in the processing area. And in processing, the information that comes in through input goes through memory. And memory is in storage or retrieval. Memory can be short-term or long-term. Then after it comes out, the other end, it comes out as output, either something written, spoken, action, something like that. So that's the process of information going into the brain and coming out as output. Okay, and you ask yourself, well, how long does that take? Seconds. It takes seconds. If you have a student who has difficulty with any of those parts of the puzzle, they may have a learning disability. Next slide. I've taken the steps and I've defined them more for you. So the model includes input going into the brain, the attention, which is how it gets focused, perception, where the brain perceives the information, the short-term or long-term memory, and how the student then gives the output. Okay, processing time. So normally, for those of us that don't have a learning disability, processing is very quick. For students that may have a learning disability, processing for them, that process that we just went through, all those steps, may take 3 times longer. So if you see a student that has difficulty, it looks like he's not understanding you, he's not picking up the steps that you're saying, it may take up to 3 times longer for him if he in fact has a learning disability. Here is a definition of learning disability. There are many, many, many of them around. They basically all have the same core parts. And I'm going to read the core parts to you. Here, permanent information processing deficit, which is a disorder. That's the main part. The second part affects the manner in which individuals with average to above intelligence learn. And I want to point out that we're not talking about people with below average intelligence. The deficits can be in any area, specifically reading, math, or written language. That's another core part, as is it's a central nervous system dysfunction. That means it's a brain-based problem. And the last sentence says that it's not affected by gender, race, or ethnic origin. And it's not the result of a poor academic background. It's not due to mental retardation or emotional disorders. So that's a good working definition of a learning disability. This is what is called a discrepancy model, and in some fields of thought this is no longer used, in others it is. If you look at these 3 arrows, they involve the diagnosis of a learning disability, and there are 3 kinds of testing for diagnosis of learning disability. The first one is information processing dysfunction. Well, that's what we just talked about. Those are the steps: input, attention, processing, output. All right, so there has to be a deficit in one of those areas. So that's the first part of a diagnosis of LD. The second, and there are tests for that. The second is intellectual potential. That means that IQ tests are given. And it has to be someone with an IQ either above average or average potential. So that is considered 1 standard deviation below average. Average is 100. 1 standard deviation is 15 points. So you're looking at up to 2 standard deviations below the norm, which is 100, which would make it 70 IQ, would be the lowest end of a normal IQ, up to whatever high-end range for a diagnosis of learning disabilities. So we've got 2 parts there and 2 separate kinds of tests: information processing and IQ test. And the last part is a significant academic discrepancy. And you may find this familiar, but you may have a student that takes a TABE test and gets a reading score of 7.8 and a language score of 8.1 and a math score of 2.0. That huge range, the 2.0 up into the 7, 8, that shows a significant academic discrepancy, and that is not normal. When you see a discrepancy of that many years, that usually is an indicator, again, of someone who may be at risk. So when you look at all three of those parts of this model, you're looking at the three requirements of being diagnosed with a learning disability. Okay, any questions on that? All right, we'll move forward. A few statistics. When I ask people if they have ever had a student with a learning disability, I know in my own mind that there are very few classrooms where there aren't one or more students who either may have a learning disability that's undiagnosed or who has a diagnosed learning disability that just they've never told anyone about. So here are some interesting statistics for you. Since I started working with learning disability, statistics show us that LD has increased almost 200%, which is a huge increase. 15 to 20% of the US population may be affected by LD. 30 to 50% has an undiagnosed learning disability. And the one that I think is the most damning in our field is that 50 to 80, that means 5 to 8 out of every 10 students in your adult education and literacy classes that have below a 5th to 7th grade level in reading either have a suspected or already diagnosed learning disability. You think about that and you realize how serious this is. 85% of all people with LD have their disability in reading, and 35% of the children that drop out of school have a learning disability. Only 1% of people with LD have the proper documentation that would get them an official accommodation. 25 to 40% on government assistance have LD. 48% are either unemployed or out of the workforce. 43% living at or below poverty. And this one that, you know, I've done a lot of training in the prison system, and they tell me when they see that 60% of inmates have a learning disability, they tell me they think that that is closer to 80% or 85%, especially when you combine it with attention deficit disorder. Common characteristics. I could probably have 20 slides on characteristics because there is no profile of LD. There are just all the different characteristics that people may have. And if you had 5 students in one class, all of them may have different characteristics. So these are just a sample. They perform tasks in a different manner from day to day. Memorizing is a problem, following columns, small print. Facial expressions, body language. Manipulating, using a keyboard, manipulating fingers. Slow reaction time, which is tied to processing. And coordination problems, poor balance. Difficulty decoding and comprehending reading. Oral language, written language, math, all the basic skills, problem areas. Organizational skills, handwriting, penmanship. Social functions, perception, interaction. Taking notes, copying from the board or from paper. Now this is an example when we talk about, in a little while, we talk about seeing letters inverted, backwards, in reverse. You can see that B, D, P, and Q are all the same shape. They all have that circle and that line. But when they're in different positions, they're different letters. And if you hear people say people with dyslexia see things backwards, that is not a true statement, actually. Okay, more skill deficits, slow at working, difficulty with spatial tasks, timing, sequencing. Remember first, second, and third. Vision and auditory perception problems. So if a teacher gives a direction, the student may have perfect hearing, but hear different words. Fine and gross motor, visual motor, auditory motor, memory, thinking, speech, and language. Okay, so I've talked about just almost every possible problem you could have in a classroom, haven't I? So that's the scope of learning disability. LD is exacerbated by substance abuse, physical abuse, alcohol, poverty, poisons, incarceration, mental illness, and many other factors. And yet when you look at all of these, you may be surprised to know that research has shown us that the #1 cause of a learning disability, which is a neurological problem, is probably environmental toxins. Okay, you can see there are social and emotional problems. You know, if you're someone who knows they're smart, and yet the things that you output, your written work, your verbal responses, if they appear to be less than your best, you can see how that would be frustrating. Okay, common learning disabilities. Now the overall topic is called learning disability. In K-12, it's called specific learning disability, SLD. And all of the specific ones underneath start with DYS, which means partial, dyslexia, partial ability in reading. It affects reading, using one or more areas of language. So it could be listening, speaking, reading, writing, and spelling. All of those things come under the dyslexia banner. And as you saw with that statistic, 85% of people with a learning disability have dyslexia. The next one is math, dyscalculia, understanding and using symbols or functions for math. Dysgraphia is handwriting and the actual act of writing sentences and paragraphs. And dysnomia is another one. It's not a top 3, but I put it in there. Dysnomia is when it's the name calling, when you have the name of something on the tip of your tongue and you just can't think of the name. I can describe something, I can see a picture of it in my head, but if I can't think of the name of it, that's called dysnomia. Any questions so far? Okay, moving on. And here are others. Dyspraxia. Dyspraxia is performing, hand, finger movement, drawing, writing, buttons, other fine motor skills, and the sequencing involved. I already told you what SLD stands for, and then the last one is an auditory processing problem or a visual processing problem. And we're not talking about a problem seeing or a problem hearing. So a student's hearing and vision may be perfect, but they're not hearing or seeing the same things that you're intending them to hear or see. Okay, the most common then is dyslexia, and I'm going to just point this out to you. It's a language-based disorder of constitutional origin characterized by difficulties in single word decoding, insufficient phonological processing. Okay, so what's that saying? Phonological means phonemes, and phonemes are the sounds. K, cat, C, k, C, k, cat. That's a phoneme. And if you say the word cat and your student hears DOG, then that is something typical of dyslexia. They don't hear the same sounds, the correct sounds, or the right order that the sound should be in. So here are some examples of someone that has dyslexia. Number one, it's hereditary. It's not common, not uncommon rather, to have siblings in the same class, to have parents and children in the same family. So it's a 50% chance of inheriting dyslexia. Dyslexia also is on a continuum, anywhere from very mild to very, very severe. And with people who are dyslexic, they have a hard time hearing or understanding sound combinations for symbols, for blending sounds together. K, a, t. You blend those three together and you have the word cat. If you don't know, k stands for a C and t stands for a T, you can't blend them together because you don't know the sounds. Okay, so you are probably familiar with reversals or missequencing or omitting letters or words. For example, B's and D's, B-R-I-D really should be B-I-R-D. O-N really is a reversal, should be N-O. The P's, the Q's, you can see that. And it's not just with letters, but it's in with numbers 6 and 9, 3 and 8. That concept of reversals, because they're not processing the letters properly, is, you know, one of the standards of dyslexia. They just don't perceive spatial things, whether it's letters or numbers. They have difficulty translating printed words into spoken words, which is called decoding. Spelling problems, rhyming. You know, kids learn to rhyme, and yet when you have, it's common for young children, but if you've got children that are 8, 9, and 10, and 11, and if they can't do rhyming words, that's an indicator that there may be a problem. Poor symbol imagery, and I'm going to give you an example of symbol imagery in a while. There is a history in people with dyslexia, whom we call dyslexics, that they have coordination problems and problems with left and right dominance. In my experience, and what I've read in research shows that more people who have dyslexia are left-handed and left-eyed than right. So an individual is identified as dyslexic when a significant discrepancy, remember that from the model, exists between their intellectual ability, their IQ, and their performance in reading. And there's no physical, emotional, or cultural cause for that to happen. Okay, are we all clear so far? Any questions?
No questions.
Okay, good. All right, the next one. You may not see this as often, as it's not as common. And also, when we see someone with poor handwriting, such as doctors or whomever we deal with, our first thought is not, oh, this person has dysgraphia. Our first thought is, oh boy, this person has bad handwriting. But as all the learning disabilities are, this is a neurological disorder that's characterized by problems in writing and the mechanics of writing. It's a form of dyspraxia, which is motor clumsiness. Okay, so disorganized writing, not having a clear purpose for writing. Those of you that are GED teachers know that this is, you know, this is a clear problem when you're trying to pass the GED exam. Odd spelling, because they may be spelling things the way they think it sounds. Poor handwriting, difficulty in mechanics, in reviewing and organizing written output. The next one is dyscalculia, and that's the math learning disability. It's the concepts in math and the functions of math. So you might say to yourself, well, if you gave your student a calculator, then they would be perfect. Yet Think of the symbols of math. Think of the symbol for adding, subtracting, multiplying, dividing. If you don't know what the correct symbol is, then you can't even use a calculator to find the answer. So I can tell you, when I was teaching, I always did color coding, and I would color code calculators. Each student had their own calculator, and I would color code the functions so that they would understand. Red might be for adding and yellow might be for subtracting, and it was very helpful for students, color coding. So characteristics of the math learning disability: they can't remember facts, or they can't retrieve them from their brain quick enough. And that's called automaticity. Automaticity with all subjects is the ability to get that information quickly, whether it's in reading or math or spelling. The more quickly your brain can pull the data you need from your storage, the better you'll be in your class. And visual imagery, okay, and we're going to talk about that in a little while. Concepts are difficult, operations are difficult, reversing numbers in a checkbook, that would make balancing checkbooks hard. Dialing phone numbers, following directions, driving, getting to the right address, finding the right apartment, calling the right phone numbers. All of these things can be very challenging for people who have dyscalculia. So let's look at the causes for a minute. Okay, there are three main causes of learning disability. I told you that it's neurological. That means this is a brain-based problem. If you think of your brain like a switchboard, and you think of a broken line on an old switchboard, that's what having a learning disability is like. That there's a broken switch, and the person with the disability has to find another circuit or another switch to make up for what's not working. And that can be caused by genetic defects. Those are things that we're born with in our DNA. Environmental factors like car accidents, healthcare problems, poor nutrition, even lack of stimulation as a baby, and again, the thing that was the main reason, lead poisoning, toxins on our environment. The third, biological. Biological can be anoxia or deprivation of oxygen before or during birth, HIV or AIDS, low birth weight, birth trauma, a number of different maternal problems before or during pregnancy, even hypothyroidism or gland dysfunctions, and other problems that the mother may have. Any problems, any questions about causes?
No questions so far.
Okay. All right, so we know now, we have an overview of what is a learning disability, but I need you to know what it is not, because that is just as important. It is not low intelligence. It's not an intellectual disability. Old days, we would call it, it is not mental retardation. That term is not used anymore. It is not a mental illness. It is not an emotional disturbance. It is not autism. It is not a visual or auditory acuity problem. LD does not stand for lazy and dumb. It's not a lack of motivation. Actually, people with learning disability try so much harder because it can be so difficult. It's not a physical problem. It's not a result of poor academic training or not being a good student. and it's not a way to avoid other issues. Learning disability is a legally defined term. It's under the Americans with Disabilities Act, it's under 504, it's under any number of federal laws that protect people that have disabilities. It is not a problem. It is not an issue. It is not a difficulty, and it's not a challenge, so to speak. It is a disability as defined by law. Okay, some questions for you. Question number 1. Are adults that enter your program routinely screened to detect undiagnosed learning disabilities? Now, if I would ask you, if we were in person and I would ask you to raise your hand, I would venture to say that no more than 1 or 2 of you in this group have ever routinely screened your students to see whether they might have an undiagnosed learning disability. Okay, am I correct in that? Okay, without any comments, I'll go on. The second point, are adults with documented learning disabilities given the appropriate accommodations to help them be successful? Well, the answer to that question must be yes, because the law says that we have to do that. But most of us don't get to the point where we even know that we have students in our room who have documented learning disabilities because they've never told us. That's called self-identification, and most of our students don't do that. In my experience, they do it when they're in a GED program and they need to have accommodations approved to take the GED test. Otherwise, we may have students sitting in our classroom every day that were in a special ed program for learning disabilities in middle school, in high school, and we don't even know about it. Okay, so what steps should we take? The first thing that I think is very important is to determine that adult's preferred learning style. So if I ask you the question, if you don't know how your students learn, how do you teach them? They come in, we know some biographical information about them, but do we know how they learn? No, not really. We will figure out how they learn by watching them, by listening to them, and by asking them. But in the beginning, we don't know, and one of the best ways to get basic understandings of how they need to learn is by doing learning style assessments. I have some wonderful free learning style assessments if any of you have never used them before and you want to try some. So email me and just say, please send me learning style assessments. The second thing, is right there, learning style inventories, right? And that helps determine what their weaknesses are. And as we should know, we can teach students more successfully if we teach to their strengths, what they're good at, and not what they're weak in. They already know what they're not good at. All right, so let's talk about screening. You probably all recognize this. I just had one of these recently. This is a Snellen chart, and a Snellen chart is for vision problems. So this is a vision chart, and we'll do that when we're maybe taking a driver's license test or getting our yearly or biannual eye exam. All right, but what this does not do, this screens for a problem, but it does not diagnose a problem. Other things have to be done before a vision problem can be diagnosed. Okay, so we're looking at screening then. Screening is the initial step in the process of gathering important information about your student that may have a suspected learning disability. So let's say you have all this knowledge now about learning disability. You have seen students that may have difficulty processing. You may have students that have a number of the characteristics that we've talked about, and you may have students who have that academic discrepancy that we looked at. So these are the students that you might want to screen to see if they are at risk for a learning disability. So these are the questions. Does your learner show an unexpected underachievement? Yet, they demonstrate evidence of at least an average ability. Remember, it has to be at least average ability. Does your learner display signs of poor vision or hearing? Remember, these are different than auditory and visual processing deficits. So the first thing that you would have to do as a classroom teacher is make sure that their hearing and their vision are correct. And I don't know how many of you have access to telebinoculars or vision tests, but those are available. And I know in my schools we used to use them. And when we would find students who had, in fact, vision problems or hearing problems, then we could recommend them to doctors for further vision or hearing testing. The third bullet, as far as academic performance, are your students having reading problems, language problems, or math problems that are not due to vision or hearing? And the last bullet, are we seeing behaviors or psychological manifestations that are interfering with his inability to learn? You can see all those things in your classroom. So what is a screening process? With a screening process, you gather information about your learner. You review the things you have observed about the learner. You actually sit down with the learner. You talk about what problems they may have. And you have to talk to them about what a screening instrument is, how it can be used, and what the results of it may mean. There are many instruments to choose from. There are many that are easy and free, and I'm giving you one that you can use for your homework assignment. You have to obtain an informed consent, which means you have to have a written document that says, if the student is of legal age, that the student gives you permission to administer this. Now, if you're doing one student at a time, you need informed consent. If you're doing it as a part of your registration process and everybody gets the same thing, then you do not need informed consent. Then you conduct the screening, and the one I'm going to give you is very simple. It only has 13 questions. It can be done in 15 minutes or so. And then afterwards, you have to sit down with the student and discuss what you found, and then what the next course of action is. For someone that scores very, very, very poorly on the screening, the next course of action would be referring them for diagnostic evaluation. And that's a whole nother topic, because that involves hours of testing by a licensed, experienced professional, costs money, so that's a whole nother workshop. Okay, so you can see the difference between the two terms. We talked about LD screening. LD screening is something that teachers can do. It answers the question, should this person be referred for diagnosis of a learning disability? That's the only thing it answers. So it helps determine the likelihood that there is a risk factor, that there may be a learning disability. It does not diagnose. It is not accepted for accommodations. Of course, it's easy, quick, and free. Now, an LD diagnosis, on the other hand, where those 3 discrepancy factors would be tested, and those discrepancy factors were information processing, intellectual ability, and the achievement discrepancy. Those 3 things are what have to be tested during an LD diagnosis, and the result of that, after many, many hours of testing and a lot of money, will in fact say whether this student has a learning disability or not. And it gets a lot more complicated too, because it'll be specific about what the deficiency is. It'll have suggestions on what can help the student, and it should also have a section on what accommodations would be beneficial. Okay, any questions so far?
No, ma'am.
Okay. Okay, there are many screening tools, some that are free, some that, cost quite a bit of money, some that require extensive training, some that don't. But they help determine the need for further assessment. It gives information about strengths and challenges that our students have. Screening tools were developed using research principles and with normative populations similar to the ones that we have in adult education. They're appropriate for use with a variety of cultures and races. They're usually free or inexpensive, quick, easy to score and interpret, very narrow in their purpose. They're only looking to find if LD might be a risk factor for them. Helps determine if further testing is necessary, and again, they do not identify or diagnose a learning disability. All right, so again, we can use it without informed consent at an orientation, registration. We can use it one-on-one with students that have learning difficulties that you have observed, with students who are not progressing that you have observed. We can administer it with learners that have a significant academic discrepancy, as I explained before, like a 6-year range in the TABE. We have to have written criteria and apply it consistently with all students that we do an LD screening with. And as I said, no informed consent is needed if we screen all students. Not that many years ago, I was working on a project in Florida where we were trying to set up regional testing centers, let's say north, central, south, where when adult education teachers had students like this and they did the screening, and the screening turned out to show risk factors, we could send our students to have free diagnostic assessments. It was a wonderful idea, and we spent a lot of time on it, but it never materialized into anything. Too bad. It was a good idea at the time. It would have helped a lot of our adult ed students, specifically those students who are trying to pass their GED test and can't. Okay, so informed consent, as I mentioned, has to say the purpose of the screening, what the screening process includes, the name of the test, who's going to do the screening, if it would be the classroom teacher or the counselor, how the results will be used, who will see the results, and where the results will be stored confidentially. Must be in a locked file cabinet according to the law. Anything pertaining to a student with a disability must be confidential. So the one I'm going to give you, we often call it the Washington 13 because there are 13 questions, but the official name is the Washington State LD Screening Tool. It was developed in the 90s, I think the early 90s, for TANF population, which would relate to students on welfare, temporary assistance to needy families, and it was 72% reliable with that population, and that's pretty good. Setting up the interview is crucial to getting honest answers from students on this screening tool. It has to be done orally and privately if you're doing it one-on-one, which is the best way to do it. The group one is a time saver, but it is not the preferred method. A client copy, which would mean an identical copy that the student would have in front of him, is optional, but is very helpful. Students like to read along with something that is being read to them, and the test is being read to them. So there's no reading comprehension that's required, because whoever is doing the screening will be reading the questions. Okay, here's an example of a number of different screening tools that I have either seen or used. I'm most familiar with bullet number 3, and that's PowerPath. I don't know if any of you have used PowerPath, but PowerPath is a whole system, and the screening tool is only one piece of it, and it requires intensive training, and the kit is in the thousands of dollars. So it is expensive, and you know the training is intensive, but it is a very good tool. Some of the others are free. The one I'm going to give you today is free. All right, so let's say we've done the screening and we've had our interview with our student, and our student has decided that although he may be scared to proceed because nobody likes tests, and you have to explain it in a way that they don't think it's just another test that they're taking, but it's a tool to help them see if they in fact may have a learning disability, because the law will protect them, and there are accommodations then that they will qualify for, but only until and after they have been screened and been tested by a licensed professional. So according to the law, they're entitled to legal protection. Everyone wants to know why they're having learning problems, especially those students who have average or above average IQ, and they know they're smart, but maybe they're just bad in math. Maybe it's just the one area that they're bad in, and everything else, they may be a gifted student. So it's an advantage to be able to progress, to get pass their GED test, to get into college, to get their degrees, do all of those things that might have been out of range, out of their reach before. But once they have a diagnosis, it may be. So accommodations, that's another, concept to be discussed when you're looking at screening or diagnosis. And you can actually talk to students about the accommodations that are available on the GED test if and when they get to that point.
Rochelle, you have a question.
Okay.
Randy's asking if you have a copy of the Washington screening tool, or where can they get one?
Yes, that is your handout, and you are going to get the full copy of the Washington 13 with all of the instructions, and you are going to use it? So that was a very good question. And this is a free, it was done with government funds, so it is in the public domain. It's free. You can take it, you can put it on the stationery of your own school. You can do whatever you want with it as long as you stick to the way it's supposed to be administered. But you can put it on school stationery. It's free for you, and very easy to do. There's just 13 easy questions. Okay, so I have two things for you here, and the first bullet is links, and that's a community of practice for disabilities, and you can see the URL. It's a free subscription for those of you that are interested in following. It's a national discussion. And the other thing is Learning to Achieve, and Learning to Achieve is it is the newest program from the education, the Department of Education, from our federal government. It comes from Links. It was developed in 2010. And it's a professional guide to educating adults with learning disabilities. So many things that you might ask about for LD will be in this guide. It's a large guide. There are other parts to that guide, and in next week's webinar I'm going to include more. All of these are free materials for you, and I'll include more things next time.
Rochelle, you got one more question.
Okay.
Kathleen is asking, if a student is screened, shows risk of factors, where do they go to receive diagnosis if they cannot afford it?
Well, that's where I said that's another workshop, because that's very complicated. Okay, my answer to that, my short answer to that is the number one place that I would send students would be to the closest voc rehab office. Now, voc rehab is the largest state agency that we have, the Division of Vocational Rehabilitation, and there are local agencies. Voc rehab, their goal, their mission is to either determine if people have a disability or work with people that already come in with a disability and help them stay employed. Either get training to be employed, or help them stay employed, help them get to their employment, help them improve employment, all employment related. So I urge you, without having this other workshop, I urge you, don't send GED students to voc rehab to say, I need to get tested for my GED. Don't ever say that, because they will show you the door. It can't have anything to do with GED. They do not do testing for GED. So students have to say, I have had difficulty all my life in reading or writing. I don't progress in school very well. I have difficulty with numbers. I have a hard time writing. I think I may have a problem. Never say anything about needing it for a GED test. So if you go with a student, or if the student goes alone or goes with a family, make sure, because they will walk them right out the door. Make sure that they go in just to say that this difficulty they have in math or reading or writing or academics of any kind make it difficult for them to get a job, keep a job. Those are the most important things. There are other places, but very impossible to find any free ones. Possibly at a later time we'll have a workshop on this, and there are many different ideas that I can give you, but voc rehab is the number one. Number two might be looking for getting a referral from your family doctor if you have insurance. A referral, just like needing to go to a doctor for back problems, you need to go to an educational psychologist or neuropsychologist for testing, and then part of your insurance would pay it. Military families, sometimes the veterans hospitals will help a family member with that. I call them the animal clubs, the Elks and the Moose and the Lions clubs. Sometimes they'll donate to the schools for things having to do with people with disabilities. So if you don't have any luck with voc rehab, there are other ways, but it's challenging because it can be $2,000 for testing. The one thing that you want to do is you want to make sure if your student has in fact been a special ed student in the past. They don't always like to ask the question to a student, you know, were you in a special class before? But if your student was a special student at one time, you might be able to find records of that student, and you might find the original testing documentation. And if it's something that's fairly recent, like with learning disabilities, it could have been within the last 5 years, you might find a testing document that shows a learning disability that would even be recent enough to be used for GED accommodation documentation. So that's always important. If you do find that a student has been in a special class, but the test was so long ago, it is no longer recent, or maybe it was done when they were children and those tests would not be acceptable for the GED test, then at least you've got a starting point. In cases in the past, I have gone to the testers that did those tests 10 or 15 years ago in my own school district and got them to retest someone. So there's a number of different things, and possibly, you know, we might have a workshop on that, but that gives you some idea.
Okay, and we have another question. We have two more. Melissa Perry's asking, how do we accommodate a student with a math disability?
Okay, in next week's workshop, I have a whole section on dyscalculia, and I have suggestions for you. I've actually written a journal article on dyscalculia and adult education students, and it'll be in a slide there. So I can talk you through some of that. If you emailed me, I can send you the URL in advance, but we're going to cover that next week.
Okay, and then we also have one. Do the students need to have a psychological completed prior to using the screen tool?
No, the screening is first. If you remember, the screening was to determine if a diagnosis is necessary. And the psychological is another word for the diagnostic assessment. So that comes later. You only do a diagnostic assessment when someone has already screened to say, oh, this person has all these risk factors. So the diagnostic is the second part of the model, and it's not done by classroom teachers. Next week is all going to be on strategies. It's going to be on instructional strategies for the teachers to use for students who may have a learning disability, and learning strategies to teach the student so the student knows how to handle problems that they are deficit at. Okay, so you've already had, I have 1 more minute left. You've already seen that the handout is going to be the Washington 13, and I want you to use that on a student who you think might have risk factors in your classroom. It doesn't even have to be in your classroom. You could use it with a family member. I just want you to have the opportunity of trying it. And it includes all of the directions, about 15 minutes. And lastly, this is the second part of the homework, and that's hopefully you'll all complete this. But my question to you is, what is the single most important thing you learned today? And the second part, how do you plan to use this information? And since we don't have the capability of having you discuss, I want you to email me. You don't have to put your name on it if you don't want, but I want like a sentence to answer each of those questions. And this technique that I'm using with you is an important technique to work with students that have learning disability, and next week I will tell you why. So you have two things to do for me today. Number one, do a screening tool of an adult. And number two, answer these two questions and email it to me. And if you have any other questions, again, my name's Rochelle Kenyon, please email it to me, email this two-question response to me, and email me any questions that you might have that you didn't get a chance to answer, and I will complete them as quickly as I can and get them back to you. I'm still working on the second week's webinar, so I have to finish that first, and as soon as I finish that, I'll get to all the questions. Okay, any last questions?
There's one last one.
Okay.
Can we screen without someone self-identifying?
Absolutely. Absolutely. You can. And that's the purpose of it. The purpose of it is to determine, after you've observed and seen, he's processing slowly, he's having difficulties, he's reversing, you can see, difficulty with spelling, with writing. You're seeing all these difficulties. You're seeing all the characteristics I've talked about today. So that's the point of screening. If someone self-identifies, then really you don't need to do the screening. The screening is to help you identify that someone has a possible risk factor for learning disability. If your student self-identifies and says, when I was in middle school, I was in a special ed class, then you already know. Then your next step would be ask them to find the original diagnostic letter from the professional that was hired to do the testing, and ask them to bring in a copy of that. And that would in fact be what would be sent along for their accommodation request. Any other questions?
No, ma'am.
Okay. I hope that this short hour gave you a good basic understanding of learning disabilities, and I hope that you do the two homework things that I asked for, and I would love to have all of you come back for the strategy workshop a week from today. And please, if you have any comments or questions, or just to say hi, email me. Hopefully there are some of you that I already know, and I'd love to hear from all of you. So thank you so very much. Until next time.